Hello, everybody. My name is Dr. Emery Pitcel. I am the owner and chiropractor of Rothrock Chiropractic and Rehabilitation. We are located here in State College, Pennsylvania, and we are continuing our podcast series that we call the Top 5 or the 5 Most Common. And it's February of 2025. We know so far we've had a very cold winter here in central Pennsylvania. January was certainly one of the coldest ones in recent memory out this way and everything. Not really so much snow. Yeah, a little bit of ice recently, but definitely more cold than anything else. But with that said, we are going to go over the top 5 most common musculoskeletal winter injuries. And this is all according to a European Orthopaedic Journal piece that was available on PubMed. I've found that I think there was two reasons why I decided that this would be useful information to get out there. Number one, we're right in February, right in the dead of winter still. Yeah, there's still 6, 8 more weeks of winter, depending on how much of an optimist versus a pessimist you want to be. So, 6 more weeks until spring or 6 more weeks until the end of winter, right? But for plenty of people, they definitely do embrace winter. They like to get out and do the skiing and the snowboarding. Or if you're like ourselves with our two girls, they really like to get out and do the sledding and the snow tubing in our backyard when we get a fresh powder of snow down and everything. But we figured it would be a fun topic to kind of go over. And we also believe that it would be really important to kind of teach people about these potential injuries and give them a couple of tips of how to stay vigilant and stay safe and stay away from these injuries. So, with all that said, let's dive right into the content, shall we? According to this European Orthopaedic Journal article, the number one most common musculoskeletal injury in the winter are knee ligament injuries. Most specifically, we're talking the ACL, anterior cruciate ligament, and the MCL, the medial collateral ligament. Now, these injuries are typically going to happen when that knee gets torqued too quickly internally, and then it takes the ligaments past their normal anatomical load and causes either a partial tear, a sprain of that ligament, or, God forbid, a full on rupture of the ligament. The most common way that this is going to happen in the winter months is with the downhill skiers and those that do snowboarding. So our recommendation is to know your physical limits. If you're headed out to like Tussey Mountain and you know that the certain hill is maybe a little more challenging than what your skill set is, then don't let anybody peer pressure you or buddy pressure you into going beyond your physical limits. Know what your conditioning is. Have good high quality equipment, and if you're not certain, pay for some lessons, like have somebody coach you up, because it's definitely not going to be fun to have to rehab through a knee injury. Now, if we're talking about a full blown tear or like even a partial tear, that's going to be talking to orthopedics, and they're going to make that assessment of if you need surgery or if they think you need some physical therapy. Really, the mild sprains or like the moderate sprains even of these two major ligaments, sometimes you won't even know that those are the ligaments that are injured. You'll just feel that you have knee pain. And if that's the case, sometimes those are the ones that we get in office and we don't necessarily obsess about what is the specific diagnosis. We just treat the knee functionally, throw some McKenzie method rehab therapy at it to give you something to work on at home, work through adjustments, lots of muscle work, some strength and stability over time until that issue is cleaned up. The other thing to be vigilant with the knee ligament injuries too is as you fall on ice, being careful with these falls and being really careful on ice and being very cautious about not letting that knee get torqued on you. The second most common injury, according to this European Orthopedic Journal article, was the rotator cuff tears or the rotator cuff injuries. Now, the rotator cuff, that is the major shoulder muscles in the back here. The most commonly irritated injured one is the muscle belly or the tendon of the supraspinatus muscle. And with these, we are being really cautious on slips and falls on ice. Particularly, what's most commonly going to happen to cause this in winter is someone is going to fall and they are going to go in place and fall out on an outstretched hand, and that shock is going to come right back all the way up the shoulder and irritate those muscle bundles. Another common thing that could happen is shoveling too heavy of snow, especially if we've got one of those more mild snows where it's like, what, 28, 29, 30 degrees when the snow comes down and it's more of a wet heavy, you have to be really careful about you turning to throw that load. If you throw and catch that shoulder just right, you can cause these injuries. Once again, just kind of like the knee, there's going to be varying severities and degrees of this injury. If we're talking something that's more like a grade one, strain or sprain or tear of the muscle, you're probably not even going to know that that is even partially torn. That responds really well to our McKenzie method exercises. We'll strengthen, stabilize it over time, and do a lot of shoulder therapy with the muscle and mobilizations in office here. But if we're talking something that's more partially to full blown torn, you're headed over to Mount Nittany or Penn's Highlands, talking to the orthopedics and having them lay out the treatment plan from there for you. Third most common injury, according to the European Orthopaedic Journal, is lower leg fractures. Now, what's typically going to happen here is once again, we are thinking about our skiing and snowboarding um, population. They're going down the hill, they lose control, and the leg definitely takes the brunt, and we get a snap and a break. Most particularly, it's going to be of the tibia and the fibula, which are the two lower leg muscles. That's the most common fracture, according to orthopedics, to see in the winter months. Um, and we also want to be cautious with falls as well too. It's another one of those things, you fall, or if you're walking on a fresh powder and you don't quite see a tree branch and then you fall and catch your leg while you're going down, that can cause the break as well too. Obviously, if we suspect a fracture, we are referring out immediately up to the emergency room. X-rays are going to be shot, and if there's determined that there's a fracture there, you're not our patient. You're going to be working with the orthopedic specialists at that point. However, I still want to at least enlarge this area a little bit, that just because something isn't broken, you could have had a near miss on the break, but then you still have some muscle irritation, muscle strain, maybe a little bit of ligament sprain to work our way through. Maybe you sustained a little bit of a hematoma where you basically bruise the muscle underneath. And that stuff can respond really well to the home rehab that we build out here and the muscle therapies and the adjustments. The fourth point here, according to European Orthopaedic Journal, fourth most common injury is the wrist sprains. Once again, much like the rotator cuff tears, we are concerned about people sustaining a slip and fall on the ice or tripping on something they can't see under the snow and landing on an outstretched hand, falling on outstretched hand, which is called a foosh injury, fall on outstretched hand. And often that's going to jam that wrist up in this direction. We're going to get compression type injuries and irritations on the back part of the hand and on the anterior part of the hand. Those are the wrist ligaments that we have to worry about getting grade 1, 2, or 3 injuries. Also, got to be concerned about potential fracture there. The most common carpal bone to break in the hand would be the scaphoid, and the most common one to sustain a dislocation would be the lunate one. Um, but regardless, if we're getting those types of strains and injuries, those are referrals out to the orthopedics. But if we're talking more like a grade 1 partial injury on one of those ligaments, you might once again not even know that there actually is a partial tear there. We treat it like any other functional wrist problem. Get after some McKenzie exercises, which typically is going to be the opposite direction in which you overloaded your hand and your wrist into, and then do some good high quality muscle releases, tendon releases, and some adjustments to get some blood flow and neurological reset into all those tissues. And the last point, according to this journal article from orthopedics, is actually number 5, is our most common and our biggest wheelhouse candidate, which is the low back strains or the lumbar disc injuries. The most common of these in the winter months is once again that wet, heavy snow and somebody going out and shoveling more than they can handle. We can also be a little concerned about falls where people maybe fall awkwardly with their back twisting, or somebody going and doing a bunch of skiing, snowboarding when they aren't up into condition for it or don't have good technique and form where they can pay for the price in their low back instead. If we see these things, whether it's a disc injury or a muscle strain, they are very good candidates to our chiropractic and rehab approach. We're definitely going to get after it with good side posture or drop adjustments, flexion distraction to pull apart the disc and the musculature and get that straight decompression on there. McKenzie method exercise is phenomenal for low back type injuries. So this is hopefully a nice little recap of what this article from the European Orthopaedic Journal said. Kind of went over 5 major injuries that we see from musculoskeletal in the winter here. Tips to kind of keep yourself healthy and keep yourself out of injuries. Wear tracks if it's going to be a really icy day. It's not very expensive to get a pair of tracks and slap them on the bottom of your boots and on the bottom of your shoes there. um, not shoveling more than you could handle, taking your time, taking it nice and easy. Or like if your neighbor has a snowblower for you to bother instead, just take the help and get the snowblower. um, Knowing your limits on your downhill type sports, whether that's even just sledding or snow tubing, or if you're hitting Tussey Mountain or the slopes with like some skiing or with some snowboarding. All good tips to stay away from the 5 most common musculoskeletal injuries in the winter months. So we hope that you all found this helpful. If this was really interesting, or if you appreciate kind of just hearing it, to stay vigilant and stay careful this winter month, we'd appreciate a comment or a like on our video to show us your appreciation. If you found this information helpful and like to learn and see more of our content come out, then subscribe to our channel, please. But otherwise, from Rothrock Chiropractic and Rehabilitation, I am Dr. Emery Pitcel. This was our top five most common podcast series. We'll be back out next month in March with a new video. And until then, we appreciate you all for watching and making it to the end of the video. Take care until next time. Thank you, everybody.